Individuality, comfort, and functionality all packed into one unique design. That describes the new KaVo treatment unit, the KaVo uniQa. My name is Linda Weik, and I'm a product manager at KaVo and will now showcase the benefits of our new treatment unit. The KaVo uniQa is the new treatment unit in KaVo's premium compact class. It offers in its diversity unique flexibility and state-of-the-art functionality. It combines proven KaVo quality with intelligent functions in a unique design. The KaVo uniQa is an optimal combination of tried and tested, new and refined details, and offers the user well-known yet optimized workflows in the areas of ergonomics, application, and hygiene. One important aspect of the treatment unit is ergonomics. The central component here is the patient chair. Whether it's the practitioner, assistant, or patient, throughout the course of treatment, ergonomics affects everyone. Let's start with the practitioner and assistant's perspective. For an ergonomic way of working, it is important to have optimal access to the patient. The new patient chair offers components matched to KaVo uniQa, which make this possible. So what does that mean? The conciseness of the base plate on the KaVo uniQa patient chair offers more legroom and thus greater flexibility in positioning, both for the practitioner and the assistant. Combined with the accessibility of the armrest, the backrest is longer, but is still flatter, and the connection of the backrest on the patient chair as a whole offers the practitioner and the assistant more flexibility to find a position that allows for ergonomic work, no matter the treatment situation. The patient chair is complemented by the proven KaVo headrest with push button. This offers easy movement of the flat guide. Due to the many setting options, the headrest offers the practitioner and assistant the possibility of positioning the patient's head so that an ergonomic way of working is possible. As an alternative to our headrest with push button, we have a new variant for our rotary knob headrest. For one, we have the improved handling of the rotary knob to make flexible positioning even easier to achieve. And then we've designed a new, flatter construction. So here too, ergonomic positioning, both for the patient and the practitioner, is possible. This variant also lets us remove and turn the head cushion, which helps us achieve optimal positioning for the treatment of both adults and children alike. We also offer for the KaVo uniQa our proven comfort head cushion. This offers the patient a more comfortable lying position, but it also gives the practitioner and the assistant more possibilities for optimal positioning. The different anatomical conditions of the user also naturally require different setting options on the patient chair. The KaVo uniQa can be adjusted from the lowest position of 350 millimeters to the highest position of 830 millimeters. This offers practitioners of various heights an optimal ergonomic way of working, whether sitting or standing. The patient chair can also handle patients who weigh up to 185 kilograms. More information on the subject of ergonomics for treatment assistance is found in our ergonomics videos. Patient ergonomics also plays a major role. The KaVo uniQa chair offers the patient many advantages. In addition to the longer backrest, we also offer extensive support for lordosis, so you can lie down as comfortably as possible. The new upholstery of the KaVo uniQa also gives the patient a comfortable surface to lie on. The bench was adjusted and made a bit longer so that tall patients have optimal legroom. We also have a new improved armrest. It can be folded down easily for entry and exit, and then folded back up to the original position. If the user is in a rush because the patient wants to get out of the chair quickly, the armrest can also be very easily pushed out of the way. The armrest is positioned so that in both a sitting and lying position, it can be lowered. And if you want a little more space, the left armrest can also be folded down. Now for the unit's command unit, known as the dentist element. Here too, the KaVo uniQa offers fantastic flexibility in the equipment options, giving the user the individual option of configuring it the way they need it for optimal treatment. The dentist element is connected to the treatment unit with KaVo's renowned delivery arm. The dentist element is available in 4 variants. The T-table, as is assembled here, which offers optimal ergonomics and positioning, the TM table, S-table, and the cart. All variants except the T-table can also be set up as a left-handed treatment unit if necessary. All variants can have 5 or 6 equipped instrument trays and can be equipped individually. For some options, there is also the 7th additional shelf. In addition to the multiflex coupling and motors, for example the KL703, the dentist elements can also be equipped with a scaler, a 3-function or multifunction handpiece, and various cameras. Specialists are also catered to. The uniQa can also be optionally equipped with the endodontic mode or a surgery mode. The dentist element is operated via a touch display. Anyone with a KaVo unit in their practice will find their way around it and recognize the KaVo DNA. But the controls are also designed with new customers in mind. They are simple, understandable, and easy to use. If no instruments are removed, you'll see the KaVo chair functions on the home screen, and other functions can be individually configured, such as the operating light or the cuspidor. Another function on the home screen is the Treatment Types button. If the instrument is removed, the instrument menu appears. Here, depending on the respective instrument, various settings can be made and then saved. The next tab on the dentist element is for the timers. Here you can set 5 different timers individually and then save them. In terms of patient communication, the KaVo uniQa offers 2 options. First, the new standalone system with a Connect base, and then our tried and tested Connexio system, connected to the patient management software system. There is a dentist element for this in a separate tab, which is activated by pressing the key or removing the camera. The subject of hygiene also plays a major role. Here the KaVo uniQa has automated hygiene programs. These are very easy to understand and can be easily implemented by following the images and information on the display. The automated hygiene programs are based on the RKI guidelines. That makes hygiene management much clearer and easier for you. In the settings menu, 6 different users can be created and configured, and other general settings for the KaVo uniQa can be made. More information on the subject of setting options and the individual configuration of the KaVo uniQa is found in the instruction video. Overall, the KaVo uniQa dentist element offers impressive flexibility in the equipment options. This is complemented by our double standard tray, with room for 2 standard trays and thus a large storage area. It is also optimally positioned through the left dentist element connection within reach of the assistant. The KaVo uniQa Assistant element offers all important functions for treatment right within reach. The Assistant element is equipped with 5 holders. These can be individually configured. Along with the spray mist extractor and the saliva ejector, a second saliva ejector, a curing light, or a 3 or multifunction handpiece can be selected. For flexible positioning, the Assistant element can be moved in different directions and set to 4 different height levels. Alternatively, there is also a short arm on the Assistant element. That's an advantage when positioning in tight spaces. To operate the functions, the Assistant element is equipped with a capacitive operating membrane. All key functions can be activated like on the touch display by touching each of the functions. The proven KaVo foot control makes for easy handling of the instruments. The easy right-to-left operation also enables ergonomic work while standing. The KaVo uniQa is supplied with a wired foot control. Optionally, however, the wireless foot control can be selected. This one has a battery life of approximately 3 months, and when you've got your hands full, you can use the instruments and many other functions of the KaVo uniQa via the foot control. From the outside, the body of the KaVo uniQa seems compact and slim, but cleverly packed inside the device body are many features that make hygiene in daily practice much easier. In accordance with the automated hygiene programs, the uniQa offers an integrated hygiene unit. The magnet on the lid makes it easy to remove. Then the integrated hygiene unit can be loaded with the instruments and hoses in an easy and intuitive way. After the program has ended, the instruments and suction hoses can be put back on the shelves. Then the hygiene unit can be simply closed back up with the lid. This centers itself using the magnetic closure. For optimal preparation, with the KaVo uniQa as well, oxygenol 6 and decaceptol gel are used. Along with the DVG water block, both bottles are hidden inside the device body, and there is an automatic dosage of both agents. The cover behind which the bottles are placed also has a magnetic closure. This makes it really easy to lift the lid, change the bottles, and then put the lid back on. This means that no manual handling of the cleaning agents is necessary, making the cleaning process much easier overall. Besides the DVG water block, the KaVo uniQa also offers a water bottle system. This is also where decaceptol is integrated in the device body. Oxygenol is dispensed manually to the bottle via the dosing unit. Automated hygiene programs are also available with this variant. This takes the user step by step through the individual points. Additional care instructions are no longer necessary. The entire hygiene process can be centrally carried out with the water bottle system too on the treatment unit. When it comes to water disposal, the KaVo uniQa is very flexible. The customer can choose from different variants. By default, external wet suction is installed, but this can go through an amalgam separator or be replaced by a separation. There is also an alternative, the fixed parts collector. With the KaVo uniQa, the various connections of the treatment unit are hidden by the cover at the end of the device body and patient chair. Thanks to the compact and slim design, the cover hood integrates optimally in the overall treatment unit. Through the connecting element between the device body and chair, maximum flexibility is made possible at the various connection points. The default KaVo uniQa comes with a porcelain cuspidor. In this variant, you can see the smoky gray color exclusive to the KaVo uniQa. The cuspidor can be swiveled toward the patient for easier rinsing, and then swung back out of the way for the rest of the treatment. The final position is signaled with the tone. Overall, the KaVo uniQa is designed to be easy to clean. Besides the smooth surfaces and the homogeneous transitions, the components are positioned so that things like the base plate are easy to get to. Various parts such as handles, instrument trays, or the cuspidor can also be removed and cleaned separately. You can find more information in our hygiene videos. The KaVo uniQa offers a large number of variants so that every practitioner and user can configure and equip the treatment unit at his or her own convenience. And if more is needed, the KaVo uniQa can be optionally equipped with a monitor or an additional device in addition to the lamp on the lamp assembly pole. And if that's not enough, our KaVo uniQa can also be combined with our central unit. Due to the large selection of upholstery colors and paint options, the practice can be given a personal touch. That was the product demonstration for the new KaVo uniQa treatment unit. Thanks, and see you soon.